Hi, I'm Dr. David Strada. I'm a physical therapist at the Tom's River location for Thompson. Today we're going to be working with our patient Brianne, who has come to us with low back pain. We're going to be taking through a progression of exercises that she has been doing in the clinic, working on a ground-up progression of the hip hinge, progressing from bridging to deadlifting, starting from her back to an actual stand-up functional exercise that she'll be using in the gym to strengthen her back and her core, and also just teach her good lifting technique to protect her back. So Brianne's going to start by performing the bridge exercise. So what we're looking for here, she's going to be driving through her feet, squeezing her butt to get some good glute activation, keeping her core stiff. So she's teaching herself how to hip hinge from her back, just getting that position without putting any stress on her back. So let's see what that looks like for Brianne. Good, so she's trying to keep a nice neutral alignment from her knee to her shoulder. She's not hyperextending her back. She's squeezing her glutes. We're not looking for her back to extend where any of the movement's coming on her spine, because that can cause some irritation to her back pain and irritate the facets in her back. So she's going to just perform 10 of them. Typically we would do 3 sets of 10 here. For the sake of our video, we're just going to run through 10 repetitions. How's that feel for you?
Awesome.
Great. So she's keeping her core nice and braced, not holding her breath. She's maintaining a normal breathing pattern as she goes through this. And this can be effective exercise used in a warm-up, pre-workout, pre-training for any other purpose as well, which she can use as she's mastered this. At this point, she's done very well with this base exercise. We can progress this to some other variations, which we won't get to right now as well. But this is a good starting point for that hip hinge. So the next exercise in our progression is the kneeling hip hinge. So Brianne's now graduated from being on her back to pushing through her knees. So this exercise still incorporates the hips and the core, while pretty much taking out the ankle, so she gets her balance. She's in a good position here to facilitate the hip hinge. Go ahead, Brianne, see what it looks like. So she's staying nice and long in her spine. She's sitting back. Sit back a little bit more. She's sitting back and just kind of squeezing her glutes. Again, she's not hyperextending to the point where her back is going to be arched. She's trying to keep that neutral position. So we just correct it a little bit. Now pull this pelvis up a little bit here as she's going there. How we feel with that. Good. Driving through the knees, staying nice and tall, and using the hands to support the bar as she's working that hip hinge in this position to work the glutes in a more functional position. So now Brianne is performing a standing hip hinge with a dowel, or in this case a cane, since we have that available. So she has got this cane contacting her head, her mid-back, and her butt, her sacrum, while she's supporting with her hands. This is ensuring that her spine is nice and arched, everything is nice and straight. She's not flexing forward to put any stress on her back unnecessarily, and she's moving from the hips, straight back, touching that wall. So the progression here is as she gets more and more comfortable, she can actually walk out if need be to emphasize more of a hip hinge. So it's going to get her a little bit deeper to be able to deadlift a little bit easier and get closer to the ground. And the key to this point is she's using her hips to lift. As I said before, she's not using her back. There's no spine motion ideally here. The cane is ensuring that everything is coming from the hips. She's using the strongest muscles in her body, her glutes, to perform this activity, to protect the hips and the back. Good. So all of these exercises so far have been progressing into a deadlift. It's a functional exercise for Brianne to lift, protecting her back, using her legs to lift in a safe manner, as well as a good training exercise to train her core, train her glutes, involving a lot of different muscles to perform this activity, which has a lot of benefits metabolically, but also functionally to perform this activity. So we'll go ahead, Brianne, let's see how we start here. So Brianne has been performing this exercise with a pad here. The pad is cueing her to stay in her hip hinge and not to squat, putting her knees forward. Since we're really looking for this exercise to emphasize the hip hinge and not a squat, we want to put the onus and emphasis on her glutes as she's sitting back, not on her knees. So we can actually get her to sit back a little bit further here, this way, and we just want her to tuck her chin a little bit this way. So she's going to be looking down at the ground here, and as she comes up, she'll be looking straight forward. That way her spine is in a nice neutral position. So right here, just like that. And then she comes up, she'll be looking straight ahead. How are we doing there, Brianne? Good. And as she adjusted, she did a very good job of leaning forward at the trunk as she hip hinges, so her chest should be coming over her feet in this position, ensuring she's sitting back to emphasize her glutes and not her knees. So a little bit more hinge here. That's a little bit better. So those knees should not be really traveling forward far here. Everything should be coming from the hips until you get to the bottom of the exercise, where you actually need to engage a little bit more of that knee flexion to pick up the weight. The stool is great for teaching this. She doesn't have to have extreme flexibility to do this. The next step would be trying to do this on a lower surface closer to the ground, which would require a little bit more flexibility, but for the purposes of what we're doing, it's still training her glutes and training the movement patterns. She's getting a training effect out of it, as well as improving her function with this activity. So we basically showed you today just some basic progressions for hip hinging, starting from the ground up into a deadlift. This is just one way this can be handled. There are other exercises that we can handle for motor control to groove this motor pattern, flexibility. There are variations that all work. Anything that's going to improve your movement works here. These are just some of the progressions we use for low back pain, which is one of our most common pathologies we see in the clinic, but we have variations to use various movements to treat neck pain, knee pain, as well as other things as well. Thank you for watching our video, and hopefully we have some more things to show you in the future that can be of use to you.